With a recent spike in antisocial behaviour, violence and burglaries in Mandurah, there has been a push for more police presence in the community. But does this actually prevent crime, or are other methods like cognitive behavioural therapy more effective? Psychologist Jen Harrington tells us whether CBT is successful as a crime prevention method.
Cognitive behavioural therapy is based on the concept that your thoughts, feelings, physical sensations and actions are all interconnected, and that negative thoughts and feelings can trap you in a vicious cycle. CBT aims to help you deal with overwhelming problems in a more positive way by breaking them down into smaller parts. Different methods are used. Sometimes it could be creating cognitive dissonance. This might be speaking to a young offender and say 19-year-old, where do they see themselves at 30? They might want to have a house, a nice car, a wife, 2 kids. And you say, okay, so how are you going to get there? And working through the steps and making them realise by sitting in a prison is not going to get them to their goal of where they want to be in the future. The CBT is found to be effective with both juvenile and adult offenders. It also reduces recidivism among sex offenders. An analysis of 548 studies assessed intervention policies, practices and programs. They found that those based on punishment and deterrence appeared to increase criminal recidivism. But on the other hand, therapeutic approaches based on counselling, skill building and multiple services had the greatest impact on reducing further criminal behaviour. One cost-benefit analysis from Iowa estimates a $35 return for every dollar invested in CBT programs. So there is plenty of evidence that it reduces further criminal behaviour. Some estimate up to 56%. There are other methods, but research has shown that CBT is the most effective.